Good morning, everyone, and welcome to Hope Hospice's Family Caregiver Education Series. I'm Debbie Emerson, Hope's community health educator and facilitator of the series. Now, today's topic is making decisions about long-term care settings, and I thought it would be a good idea to reach out to a professional in this area to give us all the guidance that we need in considering, whether to age in place and remain at home for care, if that's a possibility, or would residing in a facility be the best bet? And I'm going to turn the presentation over to our guest presenter, Christine Sevier from Creating New Hope.
So a little bit about me. So my name is Christine Sevier. I'm the owner and founder of Creating New Hope Senior Living Advisors. A little bit about my care journey. I started off as a case manager at working with at-risk youth, and then I went on to be a behavioral health counselor, John Muir. And at that same time, I was helping my mom take care of my grandparents. And then my mom passed away in 2014, and then I really had to step up to the plate with my grandparents. And luckily, we all lived within the couple mile proximity of each other, so it was fairly easy. I could drop off the kids, I could check in with grandma, grandpa, and then I can go to work. And then my grandfather passed away. And then I became the special needs conservator for my grandmother who had Alzheimer's. And that was quite the journey. And that's how Hope Hospice actually came into my life. I personally used Hope Hospice twice for both my grandmother and my grandfather for services. And I mean, talk about a wealth of support and resources. I will never forget my nurse was Joy. I don't know if she's still with the organization, but I mean, I feel like we just really trudged through the mud together. She was so amazing. So shout out to Joy if she's still with Hope Hospice. Let me click to the next slide here. So our mission is to empower families with the best information possible. When I had to make that decision of, okay, what am I going to do? I'm going to try to keep grandma home for as long as possible. What does that look like? Like many of you, I was trying to bring in caregivers around the clock, having family members step in while trying to work. And then at that time, my kids were still in elementary. So it was a lot to juggle and it was very difficult. And by the time my grandfather passed away, and then my grandmother became non-ambulatory, and I was way in over my head. I mean, I was way in over. I thought for sure, I work at the psychiatric hospital at John Muir. Certainly I can manage somebody that has Alzheimer's. But to be a caregiver and have that clinical nursing experience and learn how to change somebody in the bed and all of that, like that is a particular skill set that you have to know how to do. And then once my grandmother became dead weight, I mean, forget it. There was no way that I was able to pick her up by myself if she fell. I mean, I was, like I said, I was in over my head, and Hope Hospice really helped me during that time. And what I ended up doing was looking for some options for my grandmother, and I was less than impressed, or the cost was astronomical. So like many of you guys, I went to online searches and I did a little extra digging, and I wasn't happy with reviews. So that's how I created this business. And working with the senior living advisor, it's all about the timing. Got to find the right timing, because if your loved one is still in that very active tactile phase, like a residential care setting wouldn't be the appropriate fit for that person. And then it also has to be the right timing for the family. Is the primary caregiver willing to relinquish that role? And that is an emotional thing. I think I stayed as the primary caregiver for 2 years before one of my really good friends, who happened to be a therapist, said, "Hey, are you going to come up for air? It's been 2 years." And I remember sitting there having dinner with her thinking, I have to get back because I have to go back and change my grandmother and shower her up by 7:30. And I thought, it's 2 years and I've had not one weekend to myself, like literally 2 years, not one weekend to myself. And then having those tough conversations, which I'm sure you guys will talk about in the next speaker series, about having those tough conversations with family members. And then understanding the senior living options that are out there. And that's what I'll go over next. And then the cost. Paying for senior living and care is isn't cheap. So I always tell families, like, when you're going into this process, let's do it conservatively, because I'm starting to see a lot more people live a lot longer with dementia. And it can get really expensive. And I hate to see folks go into the, Ritz-Carlton of senior living, and then fast forward 5-7 years down the road, and now I have to show you options that are closer to a Motel 6. And then selecting the right provider, narrowing down your options and how to do that, which I'll go over. And then planning for a smooth transition, especially if your loved one has some behavioral stuff. There's a very delicate way that you can do that and make sure that transition is smooth and your loved ones do not have to go kicking and screaming. So want to talk a little bit about our Surgeon General. I think he put a report out in 2017 that he spoke about social connections were so important, and the lack of social connections can increase the risk of premature death as much as smoking 15 cigarettes a day. Now, I can tell you from my own caregiver journey, I wasn't doing anything for myself. So, not only is it important to have your loved one out there and in stimulating environments, but it's so important for you guys to take care of yourself. Unless you're a caregiver, it's hard to, chuckle about such a statement that I'm going to make, but it's a small miracle that during that 2 years that, number one, I was grieving my mother, I was taking care of my small children and taking care of my grandmother, that my marriage survived during those 2 years. Like, all honesty, that was a miracle, because it was tough. I was burning at both ends, and I hadn't seen anyone, spoke to anyone, because I didn't have the time. I didn't have the mental capacity. It was very tough. So call in the troops, lean in on, organizations like Hope Hospice for resources, support, and get connected. So these are the communities that I'm going to go over. These are the different type of care settings that you may encounter in your journey as a caregiver: independent, assisted, residential care, true memory care, and skilled nursing. So right now in independent living, what I'm seeing in the Bay Area is average cost of $4,700 to $5,800 in independent living. They're on the independent side, they don't have to have a nurse. They're primarily active older adults that don't require a lot of hands-on care. They're mostly a social, non-medical model. However, within the independent living space, they will probably have, like, maybe the second floor might be assisted living. And they're primarily going to be apartment studio like. So if you need activities, engagement, that's great to get into an independent living community and kind of age with your peers at the same time, because connections are built during this phase. Assisted living. Assisted living, licensed and regulated by the Department of Social Services. All of your meals are provided. There is a nurse on staff for those larger communities. Medication management, in-house caregivers available 24/7, daily activities, transportation, all that good stuff. And right now I'm seeing price range anywhere from probably more to $57,000 to $10,000 a month on the high end. Some communities will charge like your base rate, which will include your apartment or your studio, all of your meals, housekeeping, laundry, all of that stuff as your initial base cost. And then some of them will break off care into a couple of different models, which I'm going to break that out for you guys so you guys can have a true perspective on what that will look like. Now, true memory care. True memory care, they're going to be locked communities with the delayed egress at the doors. I'm seeing mostly shared rooms in memory care. Primarily in memory care, the residents are usually in the communal areas because they want the caregivers and the staff to have eyes on everyone. And there's going to be lots of room for that tactile phase for folks to, re-engage with their environment. And I always tell folks, when you're looking at a memory care, I have a whole entire checklist that I can send you guys to kind of hear the things that you should be asking, hear the things that you should be looking for when you're looking at memory care. When I'm going through a memory care community with the family, what I'm doing is I'm making sure that the residents are clean. Nobody's walking around with like one sock on, and both shoes. If ladies have their nails clean, hair brushed, makeup on to preserve their dignity. Those are those little things that I'm looking for in a memory care community. Not only am I checking transparency records for violations, for anything, that I wouldn't want to see going on, or an elopement risk. So those are the kind of things that I'm looking for. And memory care in this community, especially if you're high functioning and you need a lot of opportunities for stimulation, can get pretty costly. I'm seeing mostly around $72,000 to $12,000 just here in the Tri-Valley. And one other thing that I want to say about memory care, or actually independent, assisted, and memory care. One of the prohibited health conditions that tends to be problematic in these communities are insulin injections. If your loved one has a diagnosis of mild cognitive impairment, there are very few communities that can actually dial up their insulin and give them that injection, because they have to have a nurse, an LVN or an RN on staff 16 hours or more a day, according to the Department of Social Services. And there are very few communities that do that in this area. So my advice to families is, if your primary physician can prescribe metformin versus the injection, and that's safe to do so, go that route, because just to manage that one condition of the diabetic and insulin, you're looking at an additional $1,800 a month on top of your base rate and your care. So being a diabetic is very expensive in this realm. Residential communities. Here is my sweet spot. So when the time came for myself to place my grandmother into a community, she was too far gone in to even benefit from anything in the memory care communities. And I have a general rule of thumb. My general rule of thumb for any family is, when your loved one can no longer ambulate or advocate for themselves, I highly recommend a smaller residential care setting. Why? Why would you do that? Okay. I'm also a licensed administrator with the Department of Social Services, so I have the same licensing as the directors of all of these facilities in California. The larger facilities are allowed to staff according to care needs. What does that mean? Exactly. Nobody knows what that means. It could be 1 to 12. It could be 1 to 8. So in the larger settings, you will see, like, one of the questions you should ask is, in the assisted living side, is, how long are your call pendant button response times? That's one very good question that you should ask. So if your loved one is in assisted living and they know when they need to go to the bathroom and they want to preserve their dignity and still get to the bathroom on their own, and they press that button and it's going to take 15, 20 minutes, think about that. Now, on the residential care side, you're typically going to see 2 to 6, unless somebody is sleeping at night, and they'll have bed alarms for the caregivers to respond in the night. But some communities do have awake overnight staff. If your loved one drops a cup in one of these bedrooms, someone's going to respond. And they're just, soon as you start needing more support with activities of daily living, make sure you're dry, hydrated, taking your medication on time, especially when it's those tricky thyroid medications that there has to be on time. These are going to be a better option, in my opinion. And they can be half the cost once you need standby assistance in a large community. Okay, so the skilled nursing. If your loved one has a true skilled nursing need, a tracheotomy, ostomy bag, or something like this, this is where you'll end up in the skilled nursing rehabilitation communities. Now, when I'm working with families, and let's say their care needs are so significant, and maybe they have some extreme edema, they have mobility issues, and let's say they're at an assisted living community and they're already paying 14, 16, like, for example, I had a client who had Parkinson's that required that standby assistance in the bigger community. So they required him to have a 1-to-1, and he was paying over $16,000 a month. So I spoke with his family and I said, He's in the skilled nursing facility right now. He's in the private room. I mean, you can save $2,000 by just staying here and paying $14,000 a month, and then you have the clinical oversight. So sometimes families will opt to stay long-term in the skilled nursing facility, especially if those needs are truly clinical and you need that medical oversight. But this primarily, Medicare is going to pay for this. I think they're, it says 60 to 120 days or 100 days. I hardly see anyone stay that long and have Medicare pay for it. Usually you're fighting for those extra days. Okay, so understanding levels of care in assisted living. So like I was saying, there are those base rates, your rent, utilities, housekeeping, activities, transportation, laundry, all included. And you'll see assisted living, memory care varies versus a 1-bedroom, a 2-bedroom. And I always tell families, the best time to, if you're going to move to an assisted living community, is going to be between, October, November, December. That's when you can get the best pricing. You can try to secure a rate lock. A lot of communities will maybe give up a 1-bedroom for a studio price. So those are, if you're looking and you're going to be making the move and this is on the horizon, I would move between those times, because here's what I see happen a lot. After the holidays, all of the adult children go home and they're like, oh no, what are we doing? Mom should have more support. What do we need to do? And a lot of folks are moving into supportive care environments come January. So personal care costs. So like I was saying, some communities will have the level of care. Some will range from like level 1, $900 to $1,200 in addition to your base rate. Level 2, $1,900 to $2,500. Level 3, $2,900 to $3,500. I always tell families, once you're at level 3 and up, that's indicating that you're probably no longer ambulatory. You need standby assistance. You need someone to come in there and help brush your teeth. Once you're at that level of need, I suggest going to a smaller residential care home. However, if your loved one has that physical limitation, they still have that need, but they've built a community there, they have friends, they're still very social, then it may make sense to stay there. Because one of the drawbacks between the smaller residential communities is people are further along in the disease process. So it's not that stimulating of an environment. And especially when I have someone like moderate ranged cognitive impairment, we really have to take our time and find a really good residential care setting, because it's really about matching like residents with like residents. So another way that some communities are starting to break down pricing is like an a la carte model. They'll say, okay, you need bathing assistance 2 times a week, $380 a month, grooming, escorting assistance. So some communities where on the internet, it may look like, oh, wow, this is super affordable, $5,200, da, 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 da. But once you start looking at what the care levels are going to cost, that's when it can get expensive. Now, I always tell families, if you're on a budget, let's look at a place that's closer to you. Maybe you can go twice a week and help mom at the assisted living community and bathe her. So you don't have to have a kick up in that care plan, because you get to also say, hey, I want to be a part of my mom's care plan. Here's the things that I'm willing to take care of and manage on my own. Now, the one thing they probably won't let you manage is their medications. So some communities will absolutely charge for a medication plan. And then some communities will have levels that are go to a certain level of points, and they'll do an assessment, and the assessment will say, okay, based on this, you're going to be utilizing, 90 points. That's going to be about $1,800 a month. And the points can range anywhere from $12 to $25 per point. So you really have to look at that care plan and always be a part of that conversation of, when they're calling you and saying, hey, mom needs more care with XYZ. How can you be a part of that plan? For example, I had one lady who she started to get just wanted to be more isolated, didn't want to go out into the community. So they started bringing her meals to her room, and the meals would pile up and the room would get a little more cluttered with, all of the breakfast, lunch, and snacks that were being delivered to. So they bumped her up a level because they had to clean her room more often. So we said, okay, look, the daughter just is going to come here every Sunday anyway, so she'll go ahead and clean the room. And then here for the medication. So some communities will have their own medication program, and that'll be based again on points or number of passes. So if you have let's say you have 12 medications and 2 passes a day, that will correlate with a certain point, as well as grooming, mobility, and so forth. Oh, did I skip a slide here? Yep, same with toileting. I mean, everything. So when you go through the official assessment with a lot of these communities, these are the things that they're going to ask you: transferring, toileting, bathing. So residential care homes are typically a fixed price. You won't see an increase once you move in until maybe somebody's on hospice care. They need to be repositioned every 2 hours. And even then, in the smaller residential care setting, you're not dealing with a corporate entity, you're dealing with the owner. So you're developing a relationship with the owner over time. And if your budget is your budget, they're more willing to work with you. So here's my recommendations. Start the process early. Don't wait for the crisis. If you know, like, no matter what, I'm going to be here in the Tri-Valley, I want to know who are the best 3 that if that time comes, these are the places that I would consider. Involve the prospective resident as much as possible. So I have another rule of thumb. If I have a family that their loved one is still pretty ambulatory and they can get about, I want to bring them to the assessment, to the community, just to see how they might like that environment. For example, I had a family, 56, brilliant mind woman. She was diagnosed with dementia very early on, and the family was like, Christine, we can't afford the big memory cares. We want to look at these residential care models. Just please. And I said, okay, but if your loved one is an elopement risk, I'm only going to set you up failure in sending you to this place that she can walk out the door in the middle of the night. No, she won't. She's perfectly, we don't lock the doors at our house. She's never gotten out. So I said, okay, I will trust what you have to say, but let's go together. And I want you to bring mom. Mom came. She was such a sweet spirit. She would have fit in wonderful. But the first thing she did was like, oh, birds. Whoop. I went to the sliding glass door. And then right there, the owner of the community said, you know what? I wish I could take your mom, but there's just no way. And the residential communities will have a little alarm, but they're really not set up for true memory care when you're in that active tactile phase. Don't be sold on the over attractiveness of the facilities. Like I was saying, families will, first of all, this is a guilt-ridden process. Nobody wants to make this decision. Everybody wants to age in place until you can't do it anymore, for whether it's financial reasons or your own stress tolerance, right? I always see families go into the most beautiful, communities with the chandeliers and happy hour, and I'm like, okay, you sold mom's house and this is only $800,000 that you have. This is all you have. This is it, because she makes too much money in her teacher pension. She's not going to be able to qualify for any Medi-Cal benefits. So I want you to go into this moderately priced community. Like, I want you to look at this long term, because once they're in a community, they tend to live a little bit longer. They're hydrated, their medication is on time. So I always tell families, don't be oversold on the attractiveness of the facilities. Check the licensing records. And I'm going to teach you guys how to do that in this next slide. Narrow down 2 to 3 options. Visit during a mealtime. Couple of reasons why you want to visit during a mealtime. Mealtime is when the most social time. So you're going to see a majority of the residents out and about. So you're going to want to see, is it a sea of people that are in wheelchairs and walkers, and maybe they seem a little more over medicated and nobody's really communicating with each other? Those are the things that you're going to want to look at. And you're not going to find that when, you're going on a tour at 10 a.m. And try the food. our taste buds are the last to go. So I always say, try the food. Obtain a copy of the admission agreement before you go in there and sign anything. Really look through that agreement. And if there's anything that you want to strike out of there, have a conversation with that sales director and the executive director. Understand the services and the costs associated and your future cost needs. You're going to want to know, if my loved one has Parkinson's and they can no longer ambulate and they need full care, what is that going to cost? And so here's where you'll check the records for the Department of Social Services. And here's, you guys all should have given this handout. And then here's the Department of Social Services link here where you can check the information. And here's what you can find. Let me move my talking head over here. For example, you'll see this facility is licensed for 38, and they have a total of 16 type A citations. Look at this. And you can click on every single one of these reports and read the report of when the Department of Social Services, the LPA, Licensed Program Analyst, came out. What was the complaint about? What was their findings? You can, everything but the resident's name is in these reports. So I encourage you to go read them. Type A citation. A type A citation is an immediate health and safety risk. Type B citations, I see a lot more staff training, or maybe somebody's had a lapse in their paperwork. That's what I'll see. But primarily, I'm looking for these. I'm looking for the type A citations. I'm looking for major complaints. I'm looking for bed sores, personal rights violations, or caregivers that are not associated to the license, because to me, that's saying, oh, that's somebody that hasn't even been background screened. And then if you are like, okay, no matter what, we're staying home, we're going to do this thing. I run into a lot of families who are like, I'm just going to hire a caregiver for myself off of care.com or Facebook. If you're going to do that, do so very carefully, especially with the whole AB5, Assembly Bill 5, with the Uber law and independent contractors. That's getting very harder to do. So you technically are hiring somebody. You should have, workers' comp, overtime wages, sick leave, vacation, all of everything here that a licensed agency has. And there's been plenty of times where I've encountered families where they're like, oh no, Christine, I hired this caregiver from my church. Everything was going great. Dad passed away. We had a great relationship with the lady. She was live-in. And now I have a lien against my house of $230,000 for unpaid wages because she said her evenings were interrupted. There are labor law attorneys that are targeting caregivers. And they're saying, oh, were you working for this family? Blah, blah, blah. So be very careful. That's why I always say go with a licensed agency. That way liabilities on them, workers' comps on them, labor laws on them, all that good stuff. And I know it's a little expensive, but for what, $10 more an hour, you can have a little bit of peace. And here's what I'm seeing in terms of licensed home care agencies. During COVID, I never seen home care agencies go over about $35 an hour, never. And then COVID happened. And then a lot of the caregivers kind of disappeared and they went and worked for In-N-Out at $21 an hour. So now caregivers are coming into this realm and saying, nope, I want $21 to start. So the margins for a lot of these licensed home care agencies have gone away. So they've had to increase their rates. So right now in the Tri-Valley, whether it's Visiting Angels, home care assistants, The Key, all of them, they're all charging about $35 to $40 an hour, typically at a 4-hour minimum. And when you start to think about the cost comparison of staying home versus going into a community, you have to really weigh your options, because if you have to stay home and you need 24/7 care, I mean, you can blink an eye and you're paying $20,000 a month easily, on top of still maintaining the house, property taxes, all that good stuff. And that is it for my slides. I'm going to open it up for questions. If your loved one cannot afford let's just say the assisted living and any of this private paid that's out of the realm, you don't have a long-term care insurance contract, but you can apply or you can qualify for Medi-Cal. Medi-Cal. There are two options that you can take. Number one is in-home supportive services. That is a Medi-Cal benefit. If your loved one is able to get Medi-Cal, you can apply for in-home supportive services. A social worker will come out, evaluate you, and determine how many hours that you will get. And you have to find your own caregiver. That's the only drawback. They give you a list of, caregivers who are registered with IHSS, but sometimes that you kind of got to get creative. You got to get on Facebook. You got to get on Nextdoor. You got to get real creative with finding that caregiver. So that is one of the low income benefits to try to age in place.
Okay, Christine, can I interject here for a second?
Sure.
With regard to the IHSS and caregivers, families or friends can actually get certified through IHSS to be a caregiver, and then they can get paid. Or they can, give the care for free, whatever, however they want to work that out. And the training isn't, hugely live. In fact, Gia and I have done presentations for IHSS that count towards some of the training. So most of that training is online. So that's maybe an option for some people, is to go ahead and get a friend or,
a neighbor, anyone.
a neighbor, yeah, somebody you trust, and then they won't be working privately. They'll be working under the umbrella of IHSS. So it may be a good solution for some people.
Yes, absolutely. And then the other option is the assisted living waiver program. Now, it's also a Medi-Cal benefit. These are pretty hard to get. You're looking at a 2-year wait list easily. And the primary problem with this waiver is it will pay for assisted living, memory care. However, there are very few communities that accept this waiver. So because the reimbursement rate is so low, I want to say it's maybe $4,500 a month. And typically what you would do is you would go through one of these ALW participating coordination agencies. You look for one in your county. Here goes San Joaquin County. There's a few. Another one, San Joaquin. You'll register with one of these guys, and they will basically check in with you and let you know where you're at on the list. Now, this is the list of just Alameda and Contra Costa County. There are probably over, 1,800 or more licensed care communities in Alameda and Contra Costa County. And there are 10 participating facilities. And when it says capacity here, this is what they are licensed for as a building. That does not mean they have 58 ALW beds. They may take 5. There isn't, they could take 1, they could take none. So when families, what I recommend is when families go through this process and let's say they have a little bit of money, let's say they sold mom's mobile home and they have $60,000 in the bank. Take that $60,000 and go private pay for one of these facilities that already accept that waiver. That way you're already in. Do I have a listing for home care services in Tri-Valley? Yes, I will put my contact information and I'll get you send you those. How do you access the Department of Social Services website? So on the PowerPoint, there's the link. On the PowerPoint that I sent, you guys should have all gotten it. It is, or what you'll do is just Google community care licensing. What areas do you cover? I cover Alameda, Contra Costa, and I also have a retired registered nurse that works for me out of Sacramento County. And I didn't even tell you guys. So my services are 100% complimentary to the families. Families don't pay me. I'm compensated by the communities. So much like a realtor, you guys aren't going to ever cut me a check. Nothing by the hour. I will be your Sherpa down this journey of you accessing whatever it is you may need. What services do adult care centers provide? So if you look on my website, I have a resource. So if you go to creatingnewhope.org/resources, there are a few. There's very few day programs. One is choice in aging. They should be on here. Choice in Aging, they're right across from DVC. And then there is another adult day program, Daybreak. I don't know if you guys know about them. You could look into them. And then here goes Choice in Aging. And then ASEB, Alzheimer's Association of the East Bay. It's a small program. I want to say maybe 14 participants. I know at one point, Michelle was trying to open up a facility in Fremont. I'm not sure where that landed, but we need more day programs. Can you use long-term care insurance for both in-home care and a facility? Yes, you can use long-term care insurance for both. If so, I pay privately at ALW place. Do they have to keep me when my money runs out? So here is one community that our organization that I love, CANAR. I don't know if you guys know about CANAR. I'm looking at the, yep, here we go. Let me share this with you guys. CANAR. Here goes CANAR. So CANAR is California Advocates for Nursing Home Reform. If you find yourself in a situation where you run out of money, you're in a place that has the assisted living waiver, you've gone through the process, call the folks at CANAR and talk about what your transfer and discharge rights are. That's what you're going to want to do.
Okay. Christine, one of the things that I always recommend people do when they're choosing whether it be assisted living or skilled nursing is before they select that particular facility, in particular the skilled nursing, double check that they accept Medi-Cal. Most of them do, but not all. But if the facility accepts Medi-Cal and you've been a private pay, you run out of money and you need to go on Medi-Cal, they legally can't kick you out. Now, they find ways to work around that, and that's where CANAR is an advocacy agency. And if anybody has attended my previous classes, there's always a CANAR listing on my resource list that I send out. But so yeah, so when you're thinking about putting your loved one in skilled nursing and you think, oh, this is going to be long term, we may run out of money, what if? Just make sure that they're an approved Medi-Cal facility first.
Yeah, agreed. And Gia also said there's a Valley Oak Respite Center for adult day programs, persons living with dementia. Any other questions? Concerns? Yep. Perfect. All right. I think that's all the questions.
Okay, maybe just since we're a little bit early, let's just wait just a second and see if we've got any more.
I can talk about a little bit when you're moving somebody that does have dementia, maybe they're very active and they may have some behaviors, and transitioning them, you're like, oh my gosh, how am I going to make this happen? And I don't want my loved one to go kicking and screaming. I always suggest to families to go ahead and set their room up wherever you're going to place them at exactly how it is at home. Bring all of their favorites, their chair, the cup they use every morning, everything that's familiar to them. If the side table's on the right side of the lazy boy chair, bring that side table, try to match the environment. And then if your loved one has a relationship with a caregiver at the moment that's maybe coming to the house that they've bonded with, see if that caregiver can transition with your loved one for at least the first week to the community. I always like to have that, soft handoff where if I know this caregiver has been in this person's life for the last 3 years, let's keep them on for at least the first week or two if we can, and have them transition. And the communities will allow that. They will have to go and get, fingerprinted live scan. So make sure that you're have that lined up before you make that transition. And then have them transition with them for that first time. Now they can't provide care, so they're not going to be able to, help with showering and stuff like that. However, they could inform the caregiver, you know what, actually, we played this song. For example, it was very difficult to shower my grandmother. I'd put on the heater in the bathroom, open the door, I'd play Ave Maria, and I would dance all the way to the bathroom, and she would get in the shower. If I didn't do those things, forget it. I'd hear stuff from the caregiver. So finally I said, look, don't even do it. I will do it. And start to write down their specific transition periods that are difficult and what, things you're doing to adapt. I had written out a whole entire care plan and stapled it to the wall for every caregiver that came into my grandma's house to look. She likes the socks microwave with the little lavender thingies in there, put them on her feet at night and she'll go to sleep. You don't do that, she's going to kick those blankets off all night long and you're going to be like, oh, what's going on? So very as specific as you can be at what it looks like to care for your loved one, start writing those things down.
All right. So it looks like there's a couple more questions, Christine.
Okay. Is long-term nursing care covered is long-term care at nursing home covered by Medi-Cal? My mom does not have the financial resources and is early stage of dementia. We need to start looking for a place for her. So you should start getting on with that care coordinator through Medi-Cal. Get IHSS if you haven't already gotten that, and then get connected to some of these facilities that are already approved for this waiver. I'm going to see if I can answer this in chat. I'm going to put the link. Yes. Okay. So I sent you the link of approved places for Alameda and Contra Costa County. Ideally, you'll want to go to one of those places first. Given that she's Medi-Cal approved. And then here's on my website, I have a daily care planner. So let's say you find yourself that you have a caregiver at the house and you need to keep them organized. I built this for families. You can download this from my website. Just to kind of keep their personal care needs, what your expectations are, like weekly personal care needs, keep them accountable. I hear oftentimes schedule who's coming to the house. Do you have PT, OT coming? What time are they in? What time are they out? Any kind of notes. So a little resource guide that I created here.
Okay, that's an amazing resource, Christine. And I'm going to steal it, of course, and use it.
Oh yeah, totally. Take it.
So yeah, those of you who are tuned in today, that is one of the best daily care planners that I've seen. So yay.
And just, I kept one in my grandparents' car at the house, posted on the wall, because like many of you, I hired these caregivers, I'm paying all this money, and I'd come there and then, and I'm like, so, and the problem that I found was it was my fault. I wasn't educating her on what my expectations were. I wasn't educating her on how our routine was when I was taking care of my grandmother. I didn't. I didn't even think to. I was just, burning at both ends, losing my mind. So I think it's very important to set that expectation and say, hey, like when you're going to go through a home care agency, these are the things that you're going to want to ask. I have a whole presentation that I do too. If you're going to hire someone in the house, like I want to know that your caregivers can cook these 3 things. If they can't, maybe that might be a little problematic, because I have seen scenarios where families are paying $40 an hour and the caregiver's like, no, I don't cook. Like, what? I have to order food too. So just really vetting out, what agencies, are going to meet your needs. And even if they're ridiculous, what works for your loved one, require it, ask for it. Okay, Roy got the link. Any other questions?
There's one from Roy about how does one get a good evaluation of dementia? And If you'd like, I can respond to that, but if you've got some, good suggestions.
Primary neurologist. I don't know. I'm sure you guys have some great folks that you use at with Hope that you guys are partnered with.
Yeah, I primary care doctors usually is the first start. And the Medicare annual wellness visit does require that all physicians, all primary care, do an annual cognitive assessment, which is pretty basic. Draw a clock, remember these three words. It's pretty simple, and it's not enough to truly diagnose, but it's a starting point. And then what you're going to want to do, and it depends on your insurance, ask the primary care for a referral to a neurologist, a neuropsychologist, a neuropsychiatrist, for a specialist, because the evaluation isn't simply a 5-minute test, a 30-minute test. The evaluation is very, very comprehensive, and you do need a specialist to do that. So, but the first stop is primary care.
Yeah. And if you are thinking about um, moving your loved one into a community, you don't have to have a specific uh, document from a neurologist per se. You do have to have this. Can you guys see this 602 physician's report?
Yes, that's up on the screen.
Yep. So moving anyone into a supportive community, this is the one document that they will require. And it's done by your primary. If you happen to go through Kaiser, Kaiser's kind of difficult. You have to go through their documents process and do all of the things. You will have to have an updated TB test. And they just are asking general questions, primary diagnosis, secondary diagnosis. And you'll see they'll check number 9, mild cognitive impairment. I see a lot of primaries click this if there hasn't been like a true neurological exam. And anytime if your primary says, oh, based on our little mini mental, we're going to put dementia. If your loved one is still very high functioning, but maybe they can't drive anymore, but they're not maybe ready for memory care, they're in that mid range. If the doctor clicks this, you automatically have to go to the memory care side of the buildings when you're going to the assisted living. There are some communities that will have a range of higher, like they'll have 3 variations. You'll have like assisted living, and then maybe higher functioning memory care, like some will call it like life guidance. They'll have different names for it, and then lower functioning. So they try to really match the residents appropriately. Some communities do that, and then some communities there's only 1 floor for memory care, and that's that.
That's a really good tip, Christine, because that dementia diagnosis, as you mentioned, isn't just done, it can't be made, technically by the primary care. It's got to be made by a specialist.
Yeah.
So I would, especially if you're looking at moving into assisted living, I would really ensure that before somebody checks the dementia box, that you have a true definitive diagnosis.
Yep. Yep. Agreed. And then I always tell families 13 through 16, fill this out on your own, because you're going to know, their motor skills. Maybe if the left leg needs support with, or they have some skin breakdown from, maybe the wheelchair rubs against, all those little particulars, the doctors aren't really going to know these questions. So, and they will ask you, can you fill out 13 through 16 and then send it back to me? And I always tell families, don't understate what the care needs look like, because communities will reevaluate after 45, 90 days. And then you're like, oh my gosh, this is how much it's going to be. Do I see any more questions? To clarify, is Medicare requirement stating that cognitive tests be done annually? I don't know. That's a Debbie question. I think Medicare is supposed to pay for it, but I hear so often that the physicians don't or won't.
No, it is part of the annual wellness exam. And it is listed They're on the Medicare website. It's listed on all the paperwork for annual wellness. It's listed on the documents that the doctors get. These are the things that you need to do. But you're right, Christine, they don't always do it.
Yeah.
And then sometimes if the family member will say, "Hey, can you do, a cognitive screening of my mom? I'm concerned about this, that, or the other." Sometimes you'll get the response, "Well, I can't take that suggestion from you because of HIPAA."
Yep.
By the way, that is absolutely incorrect. Um, and you can also, which very, diplomatically say, "Oh, I heard that, the Medicare annual wellness does require, a cognitive screening. Can we do that?" So I mean, sometimes you just have to massage it a little bit. But yes, Medicare does require that of physicians.
Yeah. And then anytime families are in the situation where maybe they're a couple $100 of qualifying for Medi-Cal and they have a share of cost. A trick that I learned from the folks over at not Canar, HiCap, was during open enrollment period, if you sign up for the most expensive Part B, they will deduct that from your base income so you can qualify for Medi-Cal. So if you're within that threshold of being eligible, go reach out to the folks at HiCap and say, "Hey, here's my scenario. What can I do come this next open enrollment period?" And start making some changes, especially if you know that this is going to be in your future. I would start getting on the list now, getting connected with the care coordinator now. Um, One question we got: my mom wants to age in place at her home. However, her current living conditions won't allow that to happen. Home is considered hoarding. I don't think any licensed in-home care group will work in those conditions. That is correct. That is correct. I have seen some agencies decline business, or they will reach out to someone like me and I'll get them connected to maybe a professional organizer, mover, custom moving and hauling. They're great at, getting stuff cleaned out and then working with individuals. But I would certainly, and I tend to see the silent generation will listen to their doctors. So the next time you happen to be in the doctor's, ear and like, "Hey, doc, doesn't mom need to clean out her house before anyone could come in and help her?" I tend to see them listen when they see the white coats.
Yes, and I always blame everything on the doctor. Well, your doctor said this is
Yeah,
what we need to do.
yeah, yeah, exactly, exactly. I know, I know. I know my grandmother, 81, still working, believe it or not. Um, my grandmother, for my mother, she lives here in Pleasanton, and I could tell she was she could really use a cane. She could really use it. She's not going to use it. So I took her over to the foot doctor here in Dublin and got her fitted for some insoles and stuff. And the shoe doctor said, "You should probably use a cane along with these new insoles and some sturdier shoes." So sometimes you have to, walk alongside your loved one while they're making bad decisions until you could find the right person that can get in their ear.